Welcome to the Caregiver Academy video on supporting families in the IDD community. This comprehensive training focuses on resource development to help you in your caregiving journey. Our agenda covers several key topics: clinical interventions for autism, understanding habilitative versus rehabilitative support, navigating insurance and waivers, and managing caregiver stress. We will conclude with developing a family service plan. We begin with a warm welcome to CompServe Health Resources. CompServe Health is a Medicaid-enrolled provider of behavioral health and IDD services for children and adults in North Carolina and Kentucky. Our mission is empowering individuals and families through quality, compassionate care. Our services include community living support, respite care, outpatient behavioral health, and addiction treatment. Dr. Latonya Lee Niang is our Chief Clinical Officer. Our commitment centers on 4 core values: recognizing your family expertise, fostering true partnership, prioritizing caregiver well-being, and providing evidence-based care. We advocate for your child's rights and celebrate your family's strengths. Next, we will explore common clinical interventions for autism. Autism spectrum disorder is a lifelong neurodevelopmental condition affecting social communication and behavior. It is important to know that it is not caused by parenting, vaccines, or diet. Early intervention is key, and we use a strengths-based approach. The condition presents differently in every individual and often co-occurs with conditions like ADHD and anxiety. Applied behavior analysis, or ABA, is the gold standard for autism treatment. It uses positive reinforcement to teach new skills like functional communication and self-care. ABA is a comprehensive approach, including assessment, treatment planning, direct service, and vital caregiver training. It can be delivered flexibly in home, school, or community settings. Speech-language pathology, or SLP, focuses on expressive and receptive communication and addresses feeding difficulties and supports augmentative and alternative communication devices. Occupational therapy, OT, develops fine motor skills and addresses sensory sensitivities to improve independence in daily living. These collaborative therapies ensure holistic support for individuals on the autism spectrum. Other evidence-based interventions include behavioral management and de-escalation, using functional behavior assessments and behavior intervention plans. We also offer social skills training, which covers peer interaction coaching, theory of mind, and friendship development support. These interventions provide targeted support for behavioral and social development goals. Now let's look at the distinction between habilitative and rehabilitative support. Habilitative support teaches new skills for the first time, enabling independence in new areas. Rehabilitative support restores lost skills due to injury or illness, with the goal of returning to a previous level of functioning. Distinguishing between them ensures proper service structure and accurate progress measurement. For children with autism or IDD, the primary focus is habilitative, teaching skills they haven't developed yet. This distinction matters because it affects how services are structured, what insurance covers, the types of interventions used, and how we measure progress. Understanding this framework is essential for navigating care planning and funding access. The next section covers insurance, waivers, and access to services. Most private insurance plans exclude or severely limit services considered developmental or supportive, rather than medical treatment. These excluded services often include extended ABA therapy, community living support, respite care, residential support, waiver-based services, and specialized therapies. Medicaid waivers grant permission from the federal government to waive certain rules. This allows Medicaid to fund services normally excluded, opening access to comprehensive intellectual and developmental disability services. North Carolina offers common waivers such as 1915I, 1915C, Katie Beckett, and specialized waivers. The 1915I Home and Community-Based Services Waiver provides comprehensive coverage. Key benefits include community living support, respite care, environmental and assistive tech, specialized therapies, and day programs and employment. This waiver allows Medicaid to pay for habilitative services that support independence and community inclusion. Community living support, or CLS, is crucial for daily living activities and community participation. It includes assistance with self-care, skill building, and supervision. CLS is provided by trained direct support workers under clinical supervision. The coverage is 100% for eligible children under Medicaid. Respite care is a temporary, planned break for primary caregivers, allowing time for rest, errands, and appointments. Trained staff provide care in various environments. Typical options include hours-based, full-day, and overnight respite. Funding through the Medicaid 1915 I waiver covers 100% for eligible children. Next, we transition to a critical topic: caregiver stress, trauma, and why support is paramount. Research shows that caregivers of children with autism and IDD face high stress, anxiety, and depression rates. They also deal with sleep deprivation, secondary trauma, and increased health problems. Financial strain and social isolation are also common. Comprehensive support systems are critical for family stability. Caregiver burnout includes exhaustion, emotional disconnection, and reduced coping abilities. It can manifest as increased health problems and difficulty regulating emotions. The critical truth is, caregivers cannot provide their best care when depleted. Your well-being directly equals your child's well-being. Respite care is not a luxury, it is essential. It enables caregivers to rest, attend to their health, spend quality time with other family members, maintain employment, and prevent burnout. Asking for respite is asking for help, not failing, and is evidence-based for better caregiver health outcomes. Let's explore why IDD services place high value on family support and involvement. Families are the child's strongest resource. Research shows that children with family involvement achieve better outcomes. Parent coaching improves skill generalization, and family education supports sustainable behavior change. Children flourish when family and providers work together, which is why we invest in family training and partnership. Family education and training offer numerous benefits. Skills are practiced across more settings, and learning happens every day, accelerating progress. Families gain an understanding of why behaviors occur, feel more confident, and experience reduced stress and improved relationships. Expanding your support circle to include family and friends as additional caregivers builds a community of support. You can train grandparents, aunts, uncles, and close friends to provide trusted respite coverage, ease the transition to adulthood, and promote social inclusion. To prepare your extended network, educate them on your child's diagnosis and needs, teach specific behavioral strategies, and provide written guides. Start with short periods while you are present, offer feedback, and ensure the experience is positive for everyone, creating a village around your child. Our next section focuses on educating family about diagnosis and services. When all family members understand autism or IDD, it leads to consistency in approach and reduced blame and shame. It helps set realistic expectations, fosters sibling and extended support, and ultimately results in less conflict and stress for a more harmonious home environment. Understanding is the first step to acceptance. We offer critical family education covering 3 main areas. First, understanding the diagnosis with a strengths-based perspective. Second, recognizing triggers and preventing crises. Third, mastering effective interventions and reinforcing skills at home. Our resources for families include parent coaching, written guides personalized for your child, and video examples of strategies. We also offer monthly family support meetings, access to our clinical team, parent support groups, and collaborative service planning. Now let's discuss developing your customized family service plan. Building your service plan involves 3 steps. First, understand your child's strengths and challenges. Second, identify your family's priorities. Third, plan services tailored to address those priorities. Your service plan is comprehensive, detailing clear, measurable goals, specific strategies and interventions, and the service providers involved. It outlines the service dosage, location, your family involvement, progress monitoring methods, and the plan review schedule. Service plans are living documents. They are reviewed monthly with data, adjusted if strategies aren't working, and updated as your child develops new skills. We also modify the plan when family circumstances change and revise it annually with full team input. Your feedback shapes the plan. Our family-centered approach means we listen to your priorities, respect your family's values, and build on your strengths. We support your autonomy, work with you, and celebrate your child's growth. We also support caregiver well-being and partner for long-term success. We offer flexible service delivery options. Location options include in-home, school-based, and community-based services, with a combination approach being most common. Schedule options include before/after-school sessions, summer programs, respite care weekends, and flexible hours to fit your life. This concludes our video. We now invite your questions and discussion on services, diagnosis, planning, or anything else you'd like to talk about. Your next steps are to contact us to schedule a consultation, apply for Medicaid waiver services if needed, attend our monthly Caregiver Academy sessions, connect with our family support specialists, And reach out if you have any questions or need resources. Thank you for being here. Together, we support children and families thriving with autism and IDD, providing comprehensive support, family-centered care, and local expertise.